as far as the ground radar that has been taking place, but we did have to move this building 3 times. And we do have a children's grave about a half a mile away, and we encourage each and every one of you, if you have time, to take that time and go for a walk. When we purchased this, we purchased the property from the Oblates, and our elders were very, very clear on the purpose. They wanted us as Nakota people to create dialogue versus debate. And so what a great opportunity for us to do that, and to do that through history and through art. And so downstairs you will see some of the wall art with the history, and so we welcome you. There's a lot of rich and dark history here in the Battlefords. Just off the top of my head, the first industrial school to be built in Canada, the first to be closed in Canada. The last mass hanging took place not far from here. 8 warriors were hung. The fort, the railway. And so there's so much history that is transpiring and has taken place here. Moving forward, we are one of the first First Nations in Canada to have 2 herds of buffalo. It was important for us to bring back the buffalo. We have a Yellowstone herd just outside the riverfront here, and it's driving distance. And then our Elk Island herd is down along the highway near the nation. And so down along the highway near the nation. And so we're really pleased, on behalf of the leadership that you're here. But I do want to bring greetings. I want to acknowledge our health team, and our band employees. If you can stand, please, Mosquito, Grizzly Bear, Head, Lean Man, band staff, ECDEV staff. If you can stand, because I want our people, our visitors, to see that it takes a team to make something like this happen. So please acknowledge them for their hard work to make this a reality. I'm very, very proud of our health team, as a nation. 3.5 years ago, we made a collective decision at the leadership table to challenge our own people in our nation to run the first level health services. We used to be, all our services were through a third-party organization, tribal council, or a health facility. And, to see us come and make this a reality, like within 3.5 years, and to be a host to such an important conference. This is a very historic, and we're very, very pleased with the progress and the movement that's going on within our health team. It's something as a leader to see our people come together and believing in our people. And that's exactly my message, is we cannot give up on our people. We have to believe in our people and to support them where we need. So it's an absolute pleasure to welcome each and every one of you to Know Your Status Conference. It's a gathering, an opportunity of awareness, empowerment, and action. Whether you are a health professional, a student, a community leader, or an advocate here today, the message is clear: knowing your status matters, not just for ourselves, but for our communities we live in and we care about. Today, we are here to break that stigma, to share the knowledge, and most importantly, to promote awareness and to encourage testing, to have access to information, and to have access to support. And that's really key as we are working with our families and with our membership out nation to nation. Today is important, and we have to normalize the conversations, challenging those misconceptions, and to build a culture where health, especially sexual and reproduction health, is needed. We need to talk about that openly and without shame. And throughout the day, you'll hear inspiring speakers, health professionals, and peers who will share stories and resources and experiences. And I encourage you, I've been to many conferences. I encourage you to go and introduce yourself to somebody that you absolutely do not know. If anything, that's something you'll be able to walk away with, saying that you met somebody. And I'm a very shy person, and people say, no, you're not. But I know me. I know me, and if I want to be alone and by myself, I'm alone and by myself. If I want to be out there and public, I'll do that. But challenge yourself, because I've been to many, many conferences, and sometimes not even talking to anybody, but taking in all that information. So I encourage you to introduce yourself, to meet new people. So today and tomorrow, let's make this a learning, connective, and empowering experience. Thank you on behalf of the Mosquito Grizzly Bearhead Lean Man Chief and Council. Welcome once again to Know Your Status Conference.
Vice Chief David Pratt from Muscopheaton, representing the FSIN. We lost him online, so we're going to bump him down. If we can get him back, we will. We're going to move forward here with opening remarks from Dr. Thomas Wong. He's the Director General for the Office of Population and Public Health. He's also the Chief Medical Officer for Public Health and Chief Science Officer at the First Nations and Inuit Health Branch of Indigenous Services Canada. He was trained by family medicine, internal medicine, infectious disease, and public health at McGill, Harvard, and Columbia. His public health work includes engagements with Indigenous communities, HIV, hepatitis C, sexually transmitted infections, tuberculosis, influenza, vaccine preventable diseases. Ooh, this is a toughie. Antimicrobial resistance, chronic diseases, mental health, addiction, and health disparities. Make him welcome here, friends and relatives, Dr. Thomas Wong.
Thank you so much. Okay. Tanse, we are gathered here today on the traditional lands of the Mosquito Grizzly Bear's Head Lean Man First Nation, and we recognize the history and cultural significance of this land and express our gratitude to the elders, the leaders, the chiefs, and the community members, past and present, for their stewardship and teachings. It's an honor to be invited as a guest on this land and to this historic event. The first time that Know Your Status is organized and taking place by First Nations, for First Nations. And early today, as Chief Stone said, that Elder Swindler, we want to actually really acknowledge, the ceremony in the tipi, with the pipe and the four directions. And John, for the singing. And I know that the Vice Chief, will be with us momentarily. There's a sad story to begin with as we remember, all the lost children. The context of intergenerational trauma from colonization and residential schools. And that's why First Nations are facing unprecedented sexually transmitted bloodborne infection crisis and many other crises. As Justice Murray Sinclair poignantly said, these generations of Indigenous children were denied their identity, through a systematic and concerted effort to extinguish the Indigenous culture, language, and spirit. And in order to reverse that, we need to remind ourselves that Canada must do better to support the reinvigoration of Indigenous language, culture, and belongings. And when we think about STBBIs, we know that there are many, many other challenges. Geographic access, inequities in accessing, whether it's testing, health services. For many people, it would be just walking down the street and getting a test done, getting counseling done. But for many, it would mean a whole day of travel, whether it's by boat, whether it's by canoe, whether it's by air, by bus, etc. Just for a simple blood test. There's delays in turnaround times to getting results. For many who lives in big cities like Toronto, for example, they don't even think about the delays that's being dealt with by many of the First Nations here in the North, including waiting for months for results and for treatment, linkage to care. There's also stigma and discrimination. Universal health care in Canada is only universal if everyone can access it, and it's not if everyone except First Nations living in First Nations communities. Over the past number of years, since the beginning of the pandemic, many of us have witnessed that in the early waves of the pandemic, we have to actually stand in line in order to get nose swabs, in order to get a COVID test done. And it took hours and hours for us to stand in line. But things have really changed. There's communities using point-of-care testing, demonstrating that point-of-care testing can avert 33% of syphilis cases over a course of 5 years. And First Nations Health Authority, have recently released a report highlighting that reducing the historic inequities faced by individuals living in community can be overcome by using point-of-care testing led by communities. And the Australian government had commissioned a study on COVID point-of-care testing, and that up to 4,900 medevacs could be averted, and $1.8 billion Australian dollars in direct healthcare cost averted. One of the things about community-led and community-based testing is the need to be working together, whether it's the federal government, provincial government, and also Indigenous leadership, Indigenous members, community health representatives, community nursing. And since the beginning of the pandemic, over 3 million tests have been offered and distributed to many Indigenous communities, to over 400 Indigenous communities across the country. But what is needed, is we need to respect the rights, Indigenous rights, First Nations rights to self-determination. It has to be First Nations led in First Nations community and respecting traditional teachings, culture, and language. One of the leaders in medicine is First Nation physician, who's also the vice dean at the University of Manitoba, Dr. Marsha Anderson, working with colleague Melanie McKinnon, and 2 years ago published an article in British Medical Journal telling the world, everyone in the world, that we can learn so much from the COVID pandemic management strategy led by First Nations communities in Canada. We can do the same thing in Canada, listening to First Nations and learning from First Nations. As Chief Stone has said, there are so many success stories and so many initiatives here and also elsewhere in Saskatchewan and beyond that's led by First Nations. And here are some of the examples. Dr. Alexander King, Professor Malcolm King, and Carolyn Lund and colleagues have done many things over the years for hepatitis C and other sexually transmitted bloodborne infections, such as Wansika and drum and sash. And also Leslie Ann Smith, who's in the room here. And we all look forward to hearing from her later on during the conference, together with Noreen Reed and Dr. Stuart Skinner and colleagues, about Wellness Wheel, about how to actually use mobile outreach initiative to integrating services, whether it's primary care, whether it's public health, infectious diseases, non-infectious diseases, including substance use treatment and diabetes prevention and treatment. Also, CHR and Indigenous Services Canada, Staples Canada, and Jackman Foundation have been funding an initiative, Yangwa Mitswin Center, co-led by Albert McLeod, Denise Lambert, Margaret, who's in this room, and later on this morning, right after this, we'll be hearing from Margaret, about all the amazing work that Margaret, and her team have been doing together with Dr. Sean Rock about testing, treating, and linkages to culturally safe care for STBBIs. And in Manitoba, Ganiganichik, as well as Go Ask Auntie, that have been providing access to culturally safe sexual health and STBBI care. CAM co-developed knowledge bundles to strengthen the capacity to provide culturally safe and stigma-free STBBI prevention, testing, treatment, and care, and many workshops. And we'll hear a lot from Margaret in the coming minutes. And also, when we look across the country, we have seen health boxes and vending machines that are offering free, whether it's naloxone kits or personal hygiene, consumption products and educational resources in different parts of the country. These are not just in First Nations communities, but also outside of First Nations. For some, it's 24/7 access so that people don't have to say, I can only go and get these products between 9 and 3 o'clock Monday to Friday. Later on, tomorrow, we'll be hearing about a presentation on Medicine Bundle Project. And we look forward to William Plett for sharing the success stories about that. And of course, one of the things that, when I said at the beginning, Canada took away the language and culture, but as a solution, Thunderbird Foundation, First Nations, Carol Hopkins, together, with the team and colleagues of First Nations experts, developed the First Nations Mental Wellness Continuum Framework. And here it is. Culture as foundation. Culture as foundation, not just for mental health, but culture as foundation, as prevention, as treatment for STBBIs. And to close, there are so many opportunities for collaboration, whether it's distinctions-based approach, Indigenous, and in this case, First Nations-led strategies, focusing on many social determinants of health, whether it's housing, it's water, it's employment, it's education, food security, and the opportunities for collaborating across many jurisdictions. And we have to actually support access to culturally safe and community-driven services. And Miigwech.
Thank you so much, Dr. Thomas Wong. It really is nice to see that an individual of your caliber and such a breadth of knowledge is here to offer some words of wisdom and to acknowledge as well the amount of community work that needs to take place within Indigenous healthcare. It is through true community-led collaboration within these systems that we are seeing successes. So thank you so much for acknowledging those. I have the great pleasure of being able to introduce our next speaker, but before I go into that, I just want to say that the speaker and I, Margaret Kisegel Piasis, go back a long ways. I myself, Jack Salbeck, I'm not just some gorgeous looking man in front of you. I also come with experiences when it comes to Indigenous health, HIV, and other STBBI work. Margaret and I actually crossed paths back in my time when I was still a youth, back at the Youth Council, which is through CAN, which back in the day was called the Canadian Aboriginal AIDS Network. It is through Margaret's visionary, brave leadership that CAN has truly gone through such a transformation. And for myself, if I may say, being Cree, being trans, being a two-spirited gay man in today's society, there are a number of challenges that I have to face, both socially and systemically. And when we look at the aspect of healthcare and all the intertwining of sexual health, I'm just so proud to have people that acknowledge the multi-dimensional aspects of the human experience that folks like Margaret do. So it is with my true honor to be able to introduce Margaret as we go forward here. I do have a little bit of a lengthy and very robust biography because this lady has done so much for us. Mio Te Huin, Ogitsi Tasquel, kind-hearted warrior woman. The Ogumau of CAN, which is Community Alliances and Networks, Nehiao Isqueo, or a Cree woman with direct ties to the Kisagao Piesis, or Bitternose, E.T. Goose family in George Gordon First Nation and Disnomi/McLeod family of the Pipikisis First Nation in Saskatchewan, on the land which is now called Canada. The descendant of both the Moose clan and the Bear clan, living as an ancestral scientist, a knowledge keeper, and a baby ancestors practicing traditional ways of knowing, healing along the way, seeking Pimatsuin, or life, for all nations through indigenous practices, language, ceremonies, culture, and tradition. In this colonized world, Margaret is a leader, or Ogumau, of the CAN network and celebrates 30+ years of responding to the HIV, HCV, and colonial impacts to Indigenous communities through culture, ceremony, humor, and Indigenous ways of knowing and doing. So it is with my great honor I get to invite my friend, JK. Just squat.
He was on a roll. I couldn't help him, but what an introduction. Give him a big round of applause. We got Dave on the line.
Oh, yeah, wait.
It's fine.
Gorgeous.
Smooth delivery, partner.
On the line here, and he is in another meeting, but he's making some time for us here, so we'll make him welcome. FSIN Vice Chief David Pratt, a member of the Muscopheting First Nation, a strong believer in treaty rights to education, also gathering Vice Chief David Pratt.
Thanks, Cal. Thank you, everybody. Good morning, everybody. It's a beautiful morning. First of all, I want to acknowledge the Creator for blessing us with another beautiful day. Also want to acknowledge the elders that lifted pipe to start things off in a good way for us this morning. Also want to acknowledge Chief Tanya and the council, the leadership, and the elders, the staff that have put this on. Very important work. I know you're going to have a couple important days ahead of you here today and tomorrow. And I acknowledge all the presenters and each and every person that helped make this event possible. Right now, public health is so important, and it's so relevant right now in the day and age that we're living in. You know, First Nations face a lot of challenges in terms of systemic and institutional racism that go hand with a lot of what our experiences are with the healthcare system. It's not positive. And I'm really happy that a number of strides have been made in terms of improving the public health of our people. And I know that even the stigma of HIV and other communicable diseases is no longer the same. It's no longer a death sentence. And I'm so thankful for the medical advances and research that has been done to be able to making big breakthroughs amongst HIV, where it's treatable now. You could live for a number of years healthy and have a long life. And I've been following the COVID vaccine. They are now able to isolate the HIV virus when it's inside the immune virus. It identifies it right away, invades. So that's a huge scientific breakthrough for medical research. And I know that there's going to continue to be a lot of good work that's being done. And I wish you well over the course of the next couple of days here as you're gathering and having discussions along not only HIV, but other matters of public health. And I really want to acknowledge Chief Tanya Stone and her council, the health and safety of their people. That's so, so important. If we can identify and get our people tested, then we can begin treatment on them because of treaty. And I'm very excited for that and happy for that this morning. So have a good couple of days today and tomorrow. Have a great inaugural Know Your Status gathering over the course of the next few days. Kichimikwich, thank you. Have a good day and keep up the good work. Aho.
Hi, hi. Thank you so much there, Vice Chief David Pratt. Indeed, it is going to be an amazing next few days. There's going to be a lot of information, a lot of story sharing that's going to be happening. It's all within our Indigenous ways of knowing and through our Indigenous methodologies, which brings me back to my very excited introduction of Mark. Give her a round of applause as she comes up here and talks about these aspects of cultural ceremonies, of grounding things within a good way. So please give a round of applause to Margaret Kiskau. Jesus, thank you.
Naskaman, thank you for that introduction. Wow. And of course, I'll go after the Vice Chief. You know, leadership, we want people to come follow and to know that we're leading in the best way possible. You know, the opportunities that have been given to me through my ancestors have been great. The gifts that my parents and my grandparents and so on, right up to the universe, have left for me, and the prayers that they have put forward for me to be where I am today, standing in front. And, you know, I've been leading in this province for quite a while. I came and was part of the All Nations Hope Network, which is situated on over 37 years ago. And I always remember this as a mother because I've got 2 adult children, and my last baby I had, he's 37 years old. And after I had him, I went back to university, and I also went back to doing some part-time work at a local AIDS organization called AIDS Regina. I'm not sure if they're here today. There's a lot of people around here, but they're called AIDS, not AIDS Regina anymore, AIDS Program South Saskatchewan. And so I know a lot of the AIDS movement across the land, across Saskatchewan, across Canada, across the world. I've been given that opportunity to go and to speak. The one that I talk about in my bio, and a good friend of mine who's an ally wrote that bio, and she wrote it by just acknowledging and seeing the work I do and what I say. And she's great. She's so wise. You know, when you sit with people and they can listen to you and they pick up your words and they remember them, that means a lot to me as we move forward to address what we're seeing in our communities and our families. Your story is my story. As the first peoples of this land, that's what our ancestors see. That work for the National One, we were always in ceremony. And in ceremony, the ancestors came and told us that to call the people the first people of this land, because it's the government of Canada that calls us First Nations, Métis, Inuit. It's the government of Canada that put us on these reserves and put us on these lands. It's the colonial system that made the division between the United States and on Turtle Island here. My ancestors came as far as from the Black Hills. There was no border. They went to the mountains to the west and to the Great Lakes to the east, and as far north as they could go. That's who the Kisika Pieces, my ancestors, being put on reserves. Today we're operating in different spaces, but we still know that we are from this land, and we're to tell our children that you are from the first people of this land, first peoples of this land. Métis, you identify as, you are from the first people of this land. And the allies that are sitting in this room today, your ancestors came here for a better life from those came here for that Mio Pamasawan, a good life. In all of the ceremonies that I go to and I'm part of, we hear the old people asking for that, the Katayaks, the ceremonial people asking for. We talk about everything being living. This is a beautiful, beautiful place. I sat in the sun today and ate my breakfast and was thankful. The sun shining down on me. That is beautiful, to take those moments to acknowledge our grandfather, our son, the sun coming and doing that, warming us. Looking at child as keepers of life and givers of life as the women, we acknowledge that. And we know the way forward is we have to acknowledge the women. I was so happy to see the chief stand here before you, a woman leading a nation, because there are stories that have been passed down. When the women come and they start to lead, that's when we'll see healing and wellness coming to our communities once more, that Mio Pamasawan. So that's important to me as a woman and leading, and the opportunities I get to stand and speak life to people. We're looking for solutions here. We're looking at our ancestral science that has been on this land since the beginning of time. It's nothing new to me, and it's probably nothing new to some of you that understand ancestral science. But what is new is that Western science that came here to this land. And today we work with allies. I work with allies at every opportunity to look for those solutions. But I want them to acknowledge our ancestral science. Our degrees as ancestral scientists come from the universe. Western science degrees come from our universities. Today, we're raising our children, our grandchildren, and those to come to have degrees from both places. When that time comes where our young people are leading in that manner, where they're at the positions of the chief medical health officer, or the Prime Minister of Canada, and their ancestors are the first peoples of this land, and they got degrees from the universe and degrees from the universities, that's where we'll see change. That's where we'll see our science coming to life. Because we know that a pill from Western science, a pill, an injection, a drink, is going to cure what we have. We have to work with our ancestral science to dig deep, because that trauma, intergenerational trauma that our friend talked about this morning from industrial schools and residential schools and colonization, fast forward right to today of what's currently happening with what Vice Chief spoke about. The racism that occurs in our emergency wards, in our hospitals, in our social services, in our courts, in our justice systems, in our jails, injustice, inequalities that happen in those places are still happening today. And so when we see our young people starting to lead these places, these institutions and systems, changing policy, changing ways that you treatment, support, and testing, that's where we'll see a Mio Pamasawan. We know disease, dis-ease on this land was brought here. We know that as we work towards that Mio Pamasawan, we want the ease of the life to come back here once more. And this ease is not only for the first peoples of this land. We're also here for the people that came here for a better life, the allies that now are on this land. And that's important to remember, because the natural laws on this land from our ancestors, we have to take care of human beings, no matter where they came from, what color they are. We have to take care of them. And you are welcome into our lodges. You are welcome into our ceremonies. You are welcome to come and take part in our ancestral science. But you cannot run our ancestral science. It has to be given to you by a first people of this land. We see all the pretendians going down. And we have to stand up for that. We have to be strong as the first peoples of this land to know that these ceremonies, these teachings, these medicines, these relationships that we're having have to be done by the first people of this land. We need the government of Canada to fund our frontline organizations, our communities, to have our peers working at the front lines with our own people, peers that have degrees from the universe. When I'm talking about degrees from the universe, I'm talking about some of the people that are sun dancers, are rain dancers, are people that have pipes, that carry the pipes, pipe carriers, ceremonialists that do ceremony, healing ceremonies, lodges. There's so much in ancestral science. It's a beautiful, beautiful life. And to bring your children, your grandchildren, your great-grandchildren up in that knowing is important, because that's the solution that we're looking for. We're combine it with the Western science, but our ancestral science has to be right there. It has to be right there, and it has to be funded. We can no longer, if Western science was working, we would be well. We're not well. The prairies, highest number of everything, every health and social condition, you name it, the first peoples of this land are high in the statistics. And for us, our ancestral science talks to us about these diseases. These are living entities. And you hear campaigns coming from the Western ways, eradicate, kill, destroy. Doesn't that sound familiar to you? That's what they came here to do to us, to eradicate, to kill us, to destroy us, because they wanted our resources, they wanted this land. That's not how we talk about dis-ease as an ancestral scientist. These are living entities. We have to live with them. Can you imagine if you are living with HIV and you go to a meeting like this and they start talking about eradicating HIV? How would you make that person feel who's sitting in our audience listening to that? Oh, they want to eradicate me, they want to kill me, they want to get rid of me. You know, that's not the way we speak as the first peoples of this land. We have natural laws that we are always following. And the one that comes close to my heart is Sakihituin, the natural law of love. It's not a romantic notion. It's a notion that speaks to me in terms of what our Creator has told us. Kisi Manato has said the spirit that lives in you, lives in our Creator, lives in everybody. That's the spark. That's our creation story, the spark of our spirit that lives in us. We have to treat everybody in the same manner. We have to look people in the eye and greet them and thank them, no matter how they look. Even in our ceremonies today, we should be greeting people that are struggling with addictions into our ceremonies and helping them. It reminds me when some of our people say, you can't come to my lodge because you aren't 4 days clean. Those are the people that should be coming to our lodges. It reminds me of the church when they tell you can't go there if you're drunk or you're high. They kick you out of a church. And a lot of what we struggled with today are from the churches and the residential schools. And we make that connection and we acknowledge it, but we still are working towards solutions together with the churches. But the truth has to be told. We have to acknowledge that. For us to move forward, that intergenerational trauma that we carry as the first peoples of this land, we have to talk about it. We have to bring it out. We have to forgive, but we can't forget, because we do not children, grandchildren, those to come in the years to follow from here. And that's why all of you do this work, whether you know it or not. You do this work because we are always thinking 7 generations ahead. You know, when I talked earlier, I said I'm standing here because my ancestors' stories of my late father, and when I was a small girl, he would call me his little boss. And that stuck in my mind as a boss. And today I am a boss. You know, I'm a leader. But I lead with a lot of my heart, not from my head, but from my heart. And that's the way we should be moving forward to address communities and our families. Listen to the stories of your own family. Listen to your own story. And as an ally, listen, look for the stories in your families, where you came from, what land you came from, why your ancestors came here to this land that's now called Canada. Take a step back and move forward to be a better ally in looking at the situations that are happening on this land. The first peoples of this land have to lead. It's time. The prairies, we need our ancestral scientists to lead us forward, to bring those solutions to life for the sake of our own children and grandchildren and those to come. That's so important. You know, I've been at CAN over 5 years, and it was important to me as a woman that I would begin to understand what my responsibility was, what my purpose was, what am I doing here? I had to dig deep. I had to Sundance. I had to go into the lodges. I had to go see healers. I'm always in therapy. Traumas. To be a good healer, a good leader, you have to be well. When you hear some of our people speaking, you can see the hurt in them. And that to me is sad, because we have put them in leadership positions, but they are still hurting and coming out. And I'm appreciative of all of that, and I speak the truth. And I speak on behalf of, you know, I was teasing my friend Jack earlier, because when pronouns first came out, and people would say, "What's your pronouns?" And I'm like, well, I don't know. I speak on behalf of them, and they guide me, so them, they. And then I thought, well, you know, who are they, who are them? Well, they're the ancestors. So I speak on behalf of my grandmothers, and they guide me. And every opportunity I'm given to speak, I acknowledge that, because they're in the room here today. They come with me, and they help me, and they're standing behind me, and they're supporting me, and they're telling me the words to say, and what to do, and how to do it. And I get this in direction in our ceremonies. And that's the beauty of it. I don't get from here. I don't work from here. I work from here, from my heart. And I've learned that, because my first 20 years of my life working, I was fighting with this. I made myself very sick, so I take some Western medicine every day, but I also am taking some ancestral medicine to help me as I move forward. And I'm also talking about that openly and truthfully, because like I said, my story is your story. I made myself very sick by fighting that way, by doing that colonial fighting against the colonizers all the time, speaking the truth, but yet not in a good way. My ancestors didn't want me speaking that way. They wanted me to speak in a different manner, in a different way of bringing that life that has to come here on this land, and to ask our allies to listen to us now, to please listen to us and walk beside us and support us, to bring those funds into our communities, into our families, into our nations, so that we can use ancestral science and get to the root cause of what's happening in our families and our communities. You know, intergenerational trauma is very real. That's why you see our people. That's why you see our people in the news. That's why you see our people in those institutions. And that's why we've been losing a lot. My old uncle, he's 85 years old. He's the last of the Kisaka Pieces family. He's 85 years old, and I always tell him he's the last of the Mohicans, the movie. But too, he knows. And he was able to stand up and speak his truth wherever he goes. He's 85 years old. We listen. When someone speaks and they're talking about life, we listen. And he got everybody to acknowledge the cemetery on George Gordon First Nation, filled with young people. And the church, that, where they have ceremonies, whether they're traditional or church ceremonies, filled with old people. It's supposed to be the young people that do ceremony for the old people when they leave here. Now it's the old people doing ceremony for the young people because they're leaving. So, when we talk about our wellness, I hope I've shared enough and put a lot of vision and into your thoughts, into your hearts, to be able to address what we're talking about here in the next couple of days. I was so happy and so proud to come to a First Nation community and that you were hosting the Know Your Status and the welcoming and the ask that we received to come and help and be part of this solution. This is a dream come true, a vision come true for me to be able to speak in Treaty 4 territory. Oh, well, it's Treaty 4 and 6, but half of Treaty 4. To be able to speak this way, to speak life, Meopamassawan, into the people, the First Peoples of this land, and to the allies that are here to help us today. Nanaskaman for listening.
Beautiful, beautiful words. Another big round of applause, friends and relatives. We are a little fashionably early here this morning. I want to call up this young lady, Elena. Give her a big round of applause. She's going to give us a brief description of what she's going to be doing here over the course of the next couple days.
Good morning, I'm Ahilu. My name is Elena Starrett, and I come from the Gitxsan Nation, so I'm actually from BC. My father is Jamie Starrett, and my mom is Jennifer May Nee Starrett. On my dad's side, my grandfather is Neil John, and my grandmother is Barbara. And then my mom's side, my Gongkong, I'm also Chinese on that side, is, his name is Tom, and my grandma's name is Grace. And that's something we like to do in our community, specifically in Gitxsan, just so that you guys know where I came from, what my lineage is, and who my family is, and calling my ancestors into the space. So I'm going to be with you guys here for the next 2 days to do graphic recording. And some of you guys may have seen it before. It would have been maybe someone with a big piece of paper on the side of a room drawing with a bunch of markers. I do it all live, so I'll be in that back corner over there on my iPad. I promise you I'm not an iPad kid in the corner watching like movies or something. And I will be drawing the conversations that you guys will be having. So big ideas, themes, that kind of stuff. It's gonna end up on the graphic, and then I'll be able to present it back throughout the days as time permits and if we're not doing presentations and things like that. And yeah, I started my company about 4 years ago, so I've been self-employed since then, and it's been a really big journey, and I'm really excited and humbled that I was invited here to this land to do this kind of work. It's my first time here, so everything is very flat, very used to mountains and all that kind of stuff. I grew up near the Skeena River, and there's like a giant mountain there called Stikyoden, and it's huge, so it's really nice to be here, and I'm really excited to learn and be a part of this. So thank you for having me, and thank you for being open. They took it down, but there was something on the back here that kind of showed what the graphic is going to start looking like. So it had like a title and stuff, but yeah, we'll pop it up throughout the day.
All right, Elena Starrett, give her a round of applause. All right. So another facet of what we have going on here, just to complement the conference, I'm going to call up Nathan Arias from IOPS. Come on over there, Nathan. He's very shy. Give him a round of applause. Keep clapping till he gets up here, kind of thing. I worked with Nathan a lot with IOPS, and he'll tell you a little bit about it, but they kind of call us like, we work together so much. We're twins.
They don't say that.
Danny DeVito, Schwarzenegger, but I'm Schwarzenegger.
I knew he was gonna go there. I didn't know what's coming up here. Thanks, you guys. A lot of you might know who I am. A lot of you might not. I do live streaming a lot of Indigenous events, powwows, conferences. Was just out at Chief Tanya's Reserve, right across mine from Red Pheasant, doing their skate park. So that's what I do. I empower Indigenous success through live streaming, as well as my job board. Me and Cal do a lot of interviews. So I might be asking a lot of you guys today and tomorrow to do some interviews, and it's just to talk about who you are, why you're here, you know, that kind of thing. And yeah, that's about it. Or up there, whatever. Just kind of go with the flow kind of thing. That's it. That's it. That's all.
All right. We're just about at health break. Everybody stand up, please. Kind of loosen up. Oh, yeah. All right, kind of move the shoulders around like you're strutting around, like you just won at the casino and just got your cows and plows. Hands up, you just won. Yeah, wiggle your fingers. All right, now down, shake it off, And now go and shake hands with 5 people you don't know, and then you're away on health break. 5 people you don't know, introduce yourself. That's what the chief wanted, and that's how we're gonna do it.
gonna do a little restart. Yeah, Jody Stapley. Yes.
If I send you something, could you?
What are you looking at? Like a video? Yeah, I think you can just email it to me. I can just see if I can.
Hello. So I'm going to take my 2 minutes here. Cal was kind of getting mad at me that I didn't express what IOPS is really about here. So while you guys are just chilling and scrolling and whatever you're doing on this break, IOPS.ca stands for Empowering Indigenous Success. I started in 2012 as a Facebook group, and then it evolved into live streaming, and now Cal's on board. And if you guys go check out the website, iopps.ca. It is a job board, and it's geared towards Indigenous people. And I didn't even think about it to plug it here. If there is anyone here, if you guys are looking for, nurses or whatever in your guys' field, I'd be privileged if you guys used IOPS to try and find those people to work in your organizations. I'm diving deep into AI, and I just did a AI video this morning and posted it in conjunction with the job Saskatchewan Tribal Council posted. So as well, we'll be using Cal here to promote things. But we marry everything together with the live streaming and the job post. So if we're live streaming at a powwow and Cal or myself is doing interviews with people, we'll pause to it and we'll promote whatever organization is posting a job or that kind of thing. So just a quick plug about IOPS and, you know, how we do things on our side. So that's what I was supposed to say, Cal. Hope you're happy I said that now and we're good to go. Thanks, everyone.
All right, one interview done already. Give them a round of applause for those young ladies right there. Man, smooth. Just another good way of networking and reaching out to people and telling them your roles in the communities, and even being here and talking to one another and doing that networking. But if you have time, come over, see Nathan or myself, any of the breaks or lunchtime, feel free to come up and share who you are, who you work with, a little bit things like that. So thank you.
I love you, my baby. I'll always always be mommy's little stars and the sky. You'll always be mommy's little
Oh, it is good you're up. Yeah, pretty quick. 30-second warning. Oh, great there. All right, friends and relatives, we're going to ask you to take your places at this time as we'll move forward with our agenda, bring up our next speaker. Check 1, 2, check. How's that? Can you hear me, Maggie? The elders can't hear me in the back. Man, I'm talking to those guys back there. All right, now she can. All right. We're going to get started here again, friends and relatives, and my honor to bring up and introduce our next speaker here this morning. I had a chance to chat with him during our break. How about that break, though? Huh? Get to move around, get to meet some people, get to check out the ambiance of this beautiful facility. This time, friends and relatives, will bring forward our next speaker with over 50 years of service to the Onion Lake Cree Nation including extraordinary 37 years as their health director. Mr. Jimmy has been a steadfast advocate for the community, health, and wellness. His leadership has shaped and strengthened local healthcare systems. Albert Jimmy is the health director of the Onion Lake Health Center in Saskatchewan and has been recognized with the 2023 Excellence in Health Leadership Innovative Leaders Award, presented by his partnership with the First Nations Health Managers Association and the Healthcare Excellence Canada. More than a health director, Albert Jimmy is a true community health champion whose visionary leadership continues to inspire future generations of First Nations health professionals. Make him welcome here today, Mr. Albert Jimmy. Keep on clapping as he makes his way up here. Don't stop, don't stop. There you go, Albert.
Thank you. Ni gana na nas mo utawino. Katakis ka amigo ya mutata tama matsuno. E wamina no tena nas mo kitea. Ka openat spagana ix questo mago anuts. Agiska weski go gespai. I just like to thank the Creator for giving us another day to walk our lives. And I also like to thank the elder that lifted the pipe this morning to ask for a good day for us all. I have a short presentation, but it's going to be filled up the rest of the time with my associate and one of our health staff later at the end of my presentation, I guess. You want to go through who's manning my presentation? First three pictures. Oh, I got it here somewhere. Oh, okay. This one? Yeah. A few pictures are just our health center, aerial view of our health center, and entrance of our wellness program and our assisted living home. And this pictures of some of our health staff, not all of them. And when I started working under health, 1993, we started off with 7 staff members, including me. Now we reach close 240 up and down. Casuals make that up and down. Yeah. We started off with taking over the health programs, just the community health programs at that time, and a couple of non-insured health programs, which is medical transportation and the ambulance service. But the ambulance service, it wasn't really per se, we're handling it. It's just we opened up another business ambulance service on the side. It was another, what we have today, I guess. And, you know, the goal, it's immunization, school health services, in-school dental services, and health education, and physician screening, and Head Start and pre-school screening. Communicable disease program, we do the immunization, communicable disease control, environmental and occupational health and safety, but we sent this back to FNI at Speed. They didn't give us enough money. They only give us 1/10 of the salary. We couldn't hire anybody as an environmental health officer. And we do the sexual transmitted blood-borne infection program, and acute treatment services. That's with the doctors, clinics, and nurse practitioners. We also do the, keep forgetting to, what's this? No, it's not working for me. Start over again.
Let's try the little arrows.
Oh, okay.
Sorry. There you go. So just those two, if you're okay.
This one?
So that's good.
Oh, went too far now.
Oh, too far. Yeah, that one. There you go.
Okay. Okay, we also do the adult health services like diabetes, chronically ill patients. We do the health education and also the physician services assistance, also diabetes program and lab and x-ray. Some of our health staff during COVID. We also received our accreditation in 2018. And now we're starting our third round, which will be starting June 2026. And we had to do, well, not all the policies, we just enhanced the policies according to what is required. And we complied to the privacy laws. And our strategic plans priorities are included like a treaty-based funding arrangement that's been ongoing since 2016. I'm on the right slide. Partnership and services. We have an agreement, service agreement with SHA for the doctors, and they provide 2 full-time doctors to come to Onion Lake. And these doctors are paid salary, not fee-for-service like you go to other clinics, you know, in the country. It's fee-for-service. I'll just give you a little history why we negotiated that. In 2009, you know, the doctor that used to be there for the last 40 years insisted that we visit First Nations in Alaska that have their own First Nations health system, along with the state health system and the federal health system. So we visited that First Nations or their organization, and when they talked about where they were before, at that time, they talked about our health system in Saskatchewan. They talked about they used to have long wait time when you want to see the doctor. And they talk about, you know, the prescriptions they were getting, painkillers all the time, most of the time. And there was disconnect with the medical practitioners, like mental health therapists. You know, when they refer you, you have to go, you know, to the major cities to receive that. And they never have the traditional medicine alongside with the contemporary medicine and so forth. So they were describing what we have here in Saskatchewan. And when they started their own health system, today, over there, if you want to see a doctor, you don't wait. You see the doctor the same day or the same whenever you go to the clinic, right away, you see a doctor. That's how they changed the system. And the surprising part was when they mentioned about the painkillers or nerve prescription the doctors provide us here. That went down, the expenditure, sorry, wake me up too. Anyway, the expenditure really went down on that expenditure. So they asked the state, whatever money they save, they get that and they put that into their health system. So that was amazing, because the other thing they did was the traditional healers or medicine, they work alongside. I mentioned the contemporary doctors here. They work alongside. If they find what's bothering you inside, they don't give you painkillers. They take you, next office, and you start your therapy. And you have a choice, either a traditional therapist or a contemporary therapist. That's how fast you get, the treatment you needed. So that's why then they pay, their doctors on salary. So the doctors have more time to talk to you, and they really find out what's really bothering you. When they found out something is bothering you inside, they take you to the other office to start your therapy. So in essence, it really, they were doing the doctoring over there. I'm not saying they're not doing the doctoring here, but, our system is broken, and a lot of people say that. And the fee-for-service, when, let's go back a little bit, when we were starting to recruit a doctor to replace the doctor that was with us for 40 years, I started to learn the recruitment, how the doctors and how they get paid and all that. So some doctors were phoning our office, and he was talking to them, but for sometimes he was away, so I had to take the call, one call. And this doctor phoned from Manitoba, Winnipeg somewhere, and he was asking me how many patients he would see per day. So I told him what the doctor told me. An average day, a doctor would see maybe 25 or 20 patients a day. And a good day, if we're pushing it, they would see 30 or 40. So I told that to the doctor, and he says, oh, I don't think I am able to do that, because I'm seeing about 70 to 100 patients per day, he told me. So I told that to our doctor when he got back, and he said, don't call him back. He's not doctoring. He's just bringing up patients to make a lot of money, he said. So I just want to say that, that's why a lot of people are saying this system, our health system, is broken here. Not to any fault of anybody, but it's our system. Lost my thought now. Anyway, I thought I'd just mention that. Okay, I'll just go back here. I think I mentioned about the doctors. We have 2 full-time doctors. Actually, we have about 5 doctors. One of them, visit our clinic 3 days a week, and the other 4, share the other PY to fill the 2 days and the 3 days. So we have 2 full-time doctors every day. And along that, we have 3 practitioners. But at the moment, we're trying to recruit 2 more. And hopefully, we'll have 5 medical, professionals practicing if we get there. We have a medical detox that just recently opened a little over a year ago, and we have 15 beds, and it varies to each client. They stay in a detox 5 to 10 days, and we do a continuous intake, And we try to make sure there's an opening for the treatment, the 6-day treatment program for them. So that's working, the continuous intake's working. But in Saskatchewan, the other detox centers, they don't have continuous intakes. They have, periods or cutoffs, and then the clients have to wait. So that's why it's working. We don't want, to lose the clients, in between time to wait for treatment. Sorry about that again. The lab and X-ray, we have an agreement with SHA again. They provide the lab technicians, and we own all the equipment, the X-ray machine, and all the equipment that they need. So, oh, sorry. And our funding is really from not INAC anymore. It's supposed to be ISC. Used to be FINI. Yeah. Adult health services, diabetes. Oh, no, in the wrong. I'll just follow the screen. Jordan Principle, we provide the families with children requiring special care, and the funding is available for the children with motor skills delays, speech delays, or growth challenges. Part of the Onion Lake Health Board Early Child Development Program. And services are covered by non-insured benefits. Our community wellness program. Onion Lake Wellness Program is rooted in the nation's vision for healthier, holistic way of life. It recognizes that every person has the potential to grow fully and live in balance, spiritually, mentally, emotionally, and physically. And they do counseling, one-on-one counseling, group counseling, and now we're starting family counseling or family healing. And they do education and awareness. We do land-based camps and cultural camps and community education and awareness programs. Our alcohol and drug treatment program, medical detox. Our Equiskeet alcohol drug treatment program. This started 1987 with an agreement with MSP or FINI at that time. Now it's ISC. The funding stayed the same all through. They never increased it. When we want more beds, they said they're not in a mandate to be funding alcohol treatment programs anymore. Sad for me, or for all of us. And we do inpatient and outreach treatment. We offer aftercare and drug alcohol prevention services. But recently, we were talking to SHA, and I think they can, supplement the program needed here on the treatment program. And on the detox medical program, this too, we were getting a runaround from the feds back and forth. And finally, we were at the table, and the province were at the table too, both governments. And the province says, oh, we usually tender, if we're gonna entertain more beds for medical detox. You have to get on the bidders list, and you can tender for beds. So we did that. We bid for 25 beds, and we were screened one of the top 10 towards the end. And we actually negotiated, the agreement. But they came back and said, we can offer you only 8 beds. But we didn't agree. We wanted 25 beds. So we agreed initially for 15 beds, and down the road we want the additional 10 beds. So if we get there, we have 25 beds for detox, and only we have, we were funded for a treatment program, the 6-week treatment program. We're funded for 7 beds only. So that's lopsided. If you're putting out 25, detox people, they want to go into treatment, we cannot accommodate them with the 7-bed program. We have to look for other, treatment programs. And the other treatment programs, they usually have a long waiting list. So we would lose these clients. That's what's been happening. So I just want to mention that. Transition home. We all know, there's increasingly homeless people out there. In our community, we have lots too. And we try to support them with this housing, the homeless people. But, just to give you a little history on that too. When COVID hit us, the band bought trailers. One of them was a 40-man trailer and another one, 20-man trailer. Those were supposed to be used to house families that are displaced because of the drugs and gangs issue we were experiencing. In 2020, just before COVID was announced, the pandemic, we were losing quite a few young people. I think we were experiencing about 6 murders inside of 3 months, from January to February, somewhere around there. So the leadership declared state of emergency at that time, and they bought these trailers. What they were doing is, if there's a house, the family are harboring, drug dealers or gang dealers, and producing meth and all that in this house, they would close or, evict everybody, including the owners of the house, because they're harboring drug dealers or traffickers. They, evict everybody. So they displaced quite a few. And some of these families, they're not involved. They were just living with these drug dealers. So they're displaced. So that's why they bought these trailers to house these displaced people. And then COVID hit us. They couldn't do what they were planning to do. So they told us to use these trailers for, isolation for COVID patients. So that went on for a few years. And when COVID subsided, or, along there, they said, use those trailers for homeless people. So we start taking homeless people without any kind of structure. We were just taking, again, users, and they were using while we were keeping them. So there was no structure. So we revamped the program. We have a program now, we have a structure. So each client that comes into the shelter needs to sign an agreement agreeing that they will start taking the wellness program, what we're delivering from the health center. And now, when we started that, we had about 25 clients in this facility. After a couple months, 17 of them went on to do something for themselves. They went to detox, they went to treatment, they start, healing. And that's what we're doing now with the transition home. There's structure now, but more and more, there's numbers coming out. And the trailers we were given, they were old trailers. We had to repair them over and over again. And recently, leadership finally agreed with us, we cannot keep repairing these trailers. Give us new ones. They're bringing 2 RTMs now at the end of early part of November or middle of November, which is good. Okay, did I move that? Okay, home care. Home care program is provided to support the First Nations people in Onion Lake who are living on their own but cannot provide everything for themselves. And each person on home care is assessed according to what they can do or not do, I guess. And a care plan is developed and implemented by the home care staff. And they do the assessments, home management, meal preparation, personal care, respite care, and home nursing care. The assisted living home is a facility. It's in the same building. And where the elders are cared for who don't have a home or the family cannot, for some reason, provide care needed. It is a personal care home, level 1 and 2. And meaning patients meaning that they can walk and do some things for themselves. Level 4 is level 3 and 4 been written, and we're working on that. And on that, I was involved in the national review. They did national review right across, and I did involvement with a committee with the Saskatchewan review. And that review was finished about a couple of years ago. And that document recommendations went to Ottawa, and that's where it's sitting. The recommendation is there should be enough funding for, all levels of care in First Nations. Right now, level 1 and 4 are only off the First Nations, and that's where we send most of our clients into Lloydminster or other cities, Turtleford, whatever. But the document insisted or recommendation, they should be building personal care homes on First Nations. And it should come with capital monies, not just the operation and maintenance. Okay. Medical transportation, we provide this too. You're probably all familiar. The First Nations, we provide, transportation to the clients that need to go to the specialists in the major cities like Saskatoon and Edmonton. Provide the taxi service and meals and lodging. Our ambulance service, we provide the emergency services for the members of Onion Lake. This too, we had a challenge. We opened our operation 1999, and the operator close by, which was St. Walbert, came to us, wanted to sell his business to us, and we wanted to buy it. But he was asking for an outrageous price. And at that time, there was a economic development person working for us, and he says, why? So he got the statistics, how much the FNIHB was spending to transport, patients through ambulance from our reserve. Our reserve was, in St. Walbert, they're up for about 40 miles away, or 40 minutes away, I would say. Same with Lloydminster. So when we used to call an ambulance, it used to take 40 minutes to get to us and 40 minutes back to the hospital. So it wasn't really emergency service. It was just after the fact, transportation services. So we wanted our own ambulance on a reserve. So that's why we wanted to purchase it. But the economic development person advised us, don't buy for that price. And he investigated how much we can start up our own ambulance. And an ambulance at that time, 1999, the cost was about 160,000 for one unit. And that's what we did. We just bought our own ambulance and started like that. And we got operating monies from the band. And it was since operating then. But we had challenges. The fee for service is paid by Finney at that time, now it's ISC. So it wasn't enough trips to handle all the expenditures. So we were negotiating all this time. And last year, April 2024, we finally break through. SHA, finally, we have an agreement. We got the subsidy now. They're subsidizing about 60% of what we spend on the wages, and that's helped. And on top of that, we bill FNIHP fee for service. So those two incomes now are sufficient. We're okay now on that. Group homes, we have 3 group homes. First one we opened 2006, and age 8 to 16 years old. And supposed to be, we did a feasibility study, and the feasibility study calls for 2 group homes right away because we have lots of children, placed off the reserve. And we were just repeating what was happening like residential schools. Children move away from the reserve, but these ones are high-risk children. We just moved them away from the problem. They would eventually come back and they just start up again. So we wanted our own group home. So the therapy could start, locally, not just send them away for a while and then they come back and start acting up again. That's why we opened that up. But the feasibility study called for 2 group homes right at the start. 10 each group home, 20. But we only opened one because it was a new thing we were going to. We want to learn more about it. And we eventually opened a second one in 2019, around there. And this one is kind of for the younger children, 6 months to 7 years old. When we open up, I was kind of excited we're opening up for a second group home. And then I was really thinking about what's really happening here. It's really sad to be placing young babies in a group home. It really dawned to me. The parents are really involved in drugs, and they're, delivering a child that has drugs in them. So they're kept in a hospital to wean them off the drugs, and, the agency, apprehend the children, and they need a home for these babies. That's why we opened it. That's really kind of sad, and also we were happy we were opening it, but it's a kind of a sad story, and it still is today. Adult disability home, this also was initiated by one of the school teachers. He had a child that was disabled physically and wanted a program right locally on a reserve. And we had a few people that were, mentally disabled, that were walking around a reserve, and they were falling through the cracks, so to speak. Nobody really looking after them. We wanted a home for them too. And sadly, when COVID hits, most of these, the ones that we try to open, passed away at that time. So, but there's still coming up younger people, coming up adults that need this kind of a home, because most of our young people are into drugs and alcohol, and they're, you know, having children. These children are FASD, you know, clients and all that. They eventually live out, you know, their kind of a care, and they become adults. And now they need this kind of a home. And we need more of these on our reserve, and we see that. Towards the end now. Our challenges, maybe most of the First Nations will relate to that. Lack of housing, homelessness, lack of employment, drug and gang activity rampant in our reserve, health issues, diabetes, and cancer. Just to name a couple, I guess. Yeah. I just wanted to expand on the what I mentioned when we visited the Alaska Nuka model. And our vision is to start up our own First Nations health system in Onion Lake. And hopefully other First Nations would possibly do the same thing. And eventually, in Saskatchewan, we would have our own First Nations health system. And that's the plan. We have most of the services on our reserve now. And lately, we had membership engagement, you know, what they want to see in our reserve. One of the things that they were saying was loud and clear, they want a hospital or an urgent care center. An urgent care center would probably first step to do, and then a hospital. And we did a Treasury Board submission to Ottawa, you know, of our plan. So I just want to mention that I think the more we tell the First Nations, and they would come on board with us, and then we would assist them. Because we're just building our capacity in Onion Lake also. And we need to partner with the people that have been in the health business for a number of years. That's SHA and all the other, you know, jurisdictions like Alberta Health Services. We need to partner and learn from them. And then we would evolve into our own health First Nation system, and that's the plan. Thank you. I'll stop there. And I'd like to call a couple of my staff that are here. And first of all, I'd like to acknowledge them. Maybe you can stand up. These are the actually the heavy lifters of the program. Tracy Cecily and Tammy Pitts and Jody Staples and Brandy Moyo / Jimmy, my granddaughter. Is an RN. And I'll call Jody and Brandy to do the presentation of the Know Your Status topic. Brandy is one of them, and Jody is my associate. They do all the work, so that's why I assign everything to them. It's harder for me. And, you know, somebody mentioned I was awarded with kind of an excellency thing. I got the award because I have good staff. They make me look good. And that's what, thank you.
Good. Welcome, everyone. Brandy and I are just going to kind of expand on Albert's presentation and speak to our STBBI program at Onion Lake, highlight some of what the hard work that has been done, and some of our challenges and our future goals. So we have the clicker?
How do we switch? Just
This one?
maybe, oh, right here, this one. Just this little arrow.
Okay. So our STBBI program has been operating for many years. It actually started in 2000, and I was actually hired at that point to start the clinic, and I worked 1 day a week. Then it evolved over the years, and we had a nurse that worked 3 days a week in the program. And with the population growth and increased caseloads, a full-time nurse was hired in 2019. And so we provide testing, treatment, education, and prevention of sexually transmitted and bloodborne infections. And in December of 2019, we hired a full-time harm reduction nurse. And she works at Safe Supply Distributions, giving out needles, smoking kits, condoms, lubricants, Narcan kits and training, HIV self-testing kits, and Hep C and HIV follow-up. And in our clinic, we provide a supportive environment. We have some snacks. You can come in and have some coffee. We have some extra clothing. And really, we focus on education, prevention, and reducing the stigma around STBBIs. So again, here's our staff. Albert introduced everybody. This picture was taken, we just had our health forum last week, so they had a booth at their health forum. So this picture's taken then.
All right, so back in 2020, when the pandemic was full-blown force, we actually had Health Canada mobile team coming out and assisting our community with outreach. So I don't know if a lot of you know Diane Knox. She was a registered nurse. She's now retired. She lives here in Battleford, actually. So she was coming out with the mobile unit provided by Health Canada. And that's when we kind of started the outreach. So expanding our STBBI program out to the community and looking for those hard to find clients that wouldn't present to the clinic, or we couldn't get a hold of them on the phone. And so we would provide treatment, testing, harm reduction supplies, all in the mobile unit. And they assisted for 2 years until Diane retired, and then the mobile team was dismantled, unfortunately. So yeah, in 2021, funding for a second full-time RN, myself, was approved. And in 2022 is when our mobile team support ended, but we continued with the outreach, just utilizing our company vehicles. So they're just small SUVs. I believe they're Ford Edges. So we're limited on what we can do in those smaller vehicles, but we try to make it work. So Tammy Pitts, my coworker, who is the first full-time RN who was hired for this position, she mostly stays in the clinic so that if we have people that come into the clinic, there is someone there to see them, whereas I go out and I provide the outreach mostly for those people that are hard to find or if they don't have transportation into the clinic. And recently we received funding for our own mobile unit. So I don't know if all of you guys are familiar with the, I believe it's the Wellness Wheel or the Wellness Mobile Health van that they have up in the northern communities. But we've seen them at a previous Know Your Status concert, and we were inspired to get one of our own, especially too with that help from Health Canada and having that mobile unit in the beginning. In the smaller SUVs, the only treatment I can provide is chlamydia and gonorrhea treatment, so just pills. So when the mobile units stopped coming out, we weren't able to provide syphilis treatment anymore out in the community. We still transport people to the clinic for that, but it was really nice to be able to just go drive up to someone and provide treatment for everything all at once in a mobile unit. So we tried really, really hard, submitted a lot of proposals, and I believe third time's a charm, and we finally got approved. So we are expecting our unit hopefully next month or December. So this is what the unit's gonna look like. We customized it to what we kind of need. So there is privacy between the driver and the clinic area in the back. And then we have it equipped with a desk, some storage, a bed. We can equip it with Wi-Fi, things like that. So we're really excited to get that. And then, so those are just some pictures of currently what I use. I just use a tiny little phlebotomy tray to go and do my home visits. But also what really works for us is that we keep a stock of our medications in our office so that we don't have to constantly visit the pharmacy and get prescriptions from the providers for those meds. So we keep a stock of all of that on hand, and that's really helpful. We also provide a lot of education to the schools. So we go out and talk mainly to the high school. Every now and again, the elementary schools do call us over for presentations on puberty and things like that for the younger kids. But the high school education is more focused on the STBBIs and harm reduction and things like that. We have started implementing as well annual wide testing days for our community. And we've had 2 so far, and they've gone really, really well. They have exceeded our expectations. I believe our first testing day was in 2022. We were expecting maybe about 50 to 60 people. I think we tested about 75 people. So we ran out of swag bags and food and all of that we were offering. We had some really good incentives, and I think that's why we had so many people come out. Our second testing day we had in 2023, and again, that one exceeded our expectations. We estimated about 80 people. We ended up testing, I believe, 101 people and ran out of things again. So it's a really good way to get people out to the community. Obviously, we have to find money to get those incentives and get people out. Usually we find if we're giving a little treat and then some free food, people will come over. And a lot of the times it's our younger population that are coming out as well. I want to say maybe about 80% of the people that we tested were our younger adolescent community members coming out. They were coming over from the school that was just right across the street. So our next planned testing day is for March of next year. If anyone wants to come out and see what it's all about, you can get a hold of myself or Tammy or Tracy at the clinic. And I believe we did have people from Lloyd Public Health come out the first 2 times and just observe and kind of see how we went about the entire thing.
So these are just a few of our numbers of our STBBIs. So from 2022 to 2025, we observed some fluctuations in our cases. Chlamydia and gonorrhea, of course, were the most prevalent, peaking in 2023. We think due to an increase in testing and some outreach efforts. Syphilis cases were high in 2022 to 2024, but dropped significantly in 2025. Again, I think reflecting some effective contact tracing and community testing initiatives, that sort of thing. Our HIV and Hep C cases remain low, showing, probably the positive impact of harm reduction and prevention programs again over the years. So overall, these trends demonstrate the importance of early detection, timely treatment, and consistent follow-up in reducing our infection rates. And these are just some stats from our harm reduction program. So in 2024-25, we had 642 individuals access harm reduction services. So we distributed thousands of supplies including needles, crack pipes, meth kits, and ensuring safe practices. And we've had some challenges with some supplies. We had some shortages in May, August, and October, and we had some limited meth kits in July. We're now purchasing our supplies through ICMD, and so of course there was some complications with deliveries and stuff, but it didn't stop our outreach efforts. Last month we had 155 visits and again distributed hundreds of supplies. So I guess this data just shows the critical role that our harm reduction does play in preventing STBBIs and supporting our community health. So again, Albert did mention some of this, some of our challenges. The gangs kind of affecting our safety if we go out to do home visits, that sort of thing. We've had some inconsistent provider follow-ups, maybe some wrong medication or wrong treatments were given for different forms, and forms not being completed, and that sort of thing. So again, some of our successes in our programs were we were able to hire the second RN to expand our outreach program. The girls have set up a binder system that helps them track their cases and their contacts. And so again, the longer our program, then we're developing trust with the community, and we're enhancing our education and awareness initiatives. So some of our future goals, as Brandy said, we are getting our mobile clinic, which will be very beneficial. We're strengthening our education programs across the community, continuing to work to reduce stigmas and promote wellness, and building partnerships with the Regional Health Authority as well. So that's anything else to add?
No. That's it, and that's all, guys.
Yeah.
Another big round of applause for Albert and his team. Thank you very much for the presentation. What you got, Jack?
Oh, yeah, there was certainly a lot of information that was provided just in this short little hour here. And big fan of what's happening over at Onion Lake. It just goes to show that when you're multidimensional and you have such an amazing, enthusiastic team behind you, you can do so much. So I hope that also gives you, as other people, other leaders in your own nations, a little bit of motivation to know that, hey, I can do this too. But needless to say, I think I hear some tumbling.
Yeah. It's not hand drum.
Yeah,
It's
no,
their
that's
bellies.
the bellies. Yeah, that's what I thought it was. All right. But we do have lunch, but before we get to the lunch,
All right.
I'm gonna set you up. I just want to also encourage you that after lunch, take a walk around, and more than highly recommend going to check out the Children's Burial Site, which is just over in this direction. Whether or not you want to walk in that area or actually take the provided side-by-side for those folks who need or require, it is open for you. As well, please come back shortly before 1 p.m. as I'm also going to hold myself to that. I recognize I got way too social downstairs and I missed our 11 kickoff for Albert, so my apologies about that.
Indian time is usually ahead of schedule. Saddleback time about 3 minutes behind.
Exactly. But lunch will be served. So Cal, what's on the menu?
Menu items here today, you're going to be pretty happy. We got Yellowstone smoked bison ribs and Elk Island bison braised stew. I know, I'm just kidding. We got lemon pepper chicken. All right. So it is now lunchtime. Don't forget, it's buffet style, right?
It's buffet style.
Buffet style, elders first, younger elders, older adults, mid-aged elders, and so on and so forth. So thank you. Enjoy your lunch.